Alcohol, being such widespread and legally obtainable, is arguably the substance with the biggest effect on our society as a whole. While I'm sure most of us have had occasions where they had one drink too many and felt terribly in the morning after, these bodily aches are nothing compared to the devastating effects that prolonged alcoholism induces on the human body. And while the exact definitions of alcoholism and the limits of a harmful consumption are still debated, the effects of alcohol abuse on the body and mind remain evident regardless. On a psychological level, craving, loss of control, tolerance, and the negligence of one's needs and duties in life to drink more alcohol become apparent. Physically, the effects of an alcohol use disorder are so wide that it would be impossible to cover them in just one video. Some of them, like liver cirrhosis, pancreatitis, or the effects of alcohol on unborn children by pregnant mothers, are more widely known even among those who do not practice the medical arts daily. Some complications, like the development of cancer of the larynx, esophagus, and pharynx, or alcohol-induced polyneuropathy, or Wernicke-Korsakoff syndrome, are less known by the general populace. However, today we will look at a case of an alcohol-induced disease so rare and strange that even many medical professionals have never heard of it, and its prognosis is bleak. Hello everybody, my name is Doc Feedy, and I'm glad to have you back. I like to look at strange and unsettling true fates that people such as you and I have suffered through. And since I am a medical doctor, I have a special inclination to discuss fascinating cases with a medical touch that have befallen the human body, but that will not be my only focus. So, if you like the content you're about to watch, consider smashing the like button or subscribing to see more content such as this. And before watching, thank you for the support, and let's bury ourselves into this case. In the year of 2012, a 51-year-old white man living in Brazil was presented at the University Hospital in the state of Paraná in the south of Brazil. The man was a seasoned drinker and hard alcoholic with more than 30 years of hard alcohol consumption behind him, drinking every day and with no intention of stopping, according to his family. To his repertoire, cognac, rum, and wines were what he consumed the most. 1 year before being seen by medical professionals for the first time, the man's family already began noticing a decrease in short-term memory. Now yes, while aging, people tend to become slightly more forgetful. It becomes much more alarming when this loss of memory starts to impact everyday life in a meaningful way, meaning that there are both social and professional consequences to the person afflicted. Furthermore, the man complained of paresthesias of lower and upper limbs. Anyone who has ever laid on their arm for a long time knows what paresthesias are. They're a discomforting sensation that is not painful, but is akin to a tingling of electricity, a slight burn, or a marching of ants over one's body parts. These can be fleeting, like sitting on one's arm to give yourself a stranger, or permanent in one or several limbs, like for those afflicted by polyneuropathy, as in badly adjusted cases of diabetes, or as a result of a big herniated disc in the spine with a relevant compression of the spinal cord. Now, these symptoms in on itself are noteworthy and justify a timely, but not an urgent presentation at your next neighborhood neurologist. However, the Brazilian man's situation escalated dramatically when, after once again indulging in copious amounts of alcohol, the normal amount of drowsiness turned into prolonged stupor and subsequently into a coma, leading to his urgent presentation at emergency care. There, the medical team noticed a severe impairment of consciousness, according to the Glasgow Coma Scale, a clinical rating tool designed to rate consciousness levels in brain injuries. Mysteriously though, other than his deep state of coma, he showed no other clinical signs as to why he fell into this coma other than the alcohol itself. There were no leading neurological deficits indicating ischemic stroke, no meningeal irritation indicating meningitis or a subarachnoidal hemorrhage, no cranial nerve anomalies indicating an increase in intracranial pressure. So, excluding all of these reasons, the medical team at the local hospital, as a first move, started to administer vitamin B1 in high doses, along with other vitamins. Vitamin B1 is also known as thiamine. Now, this might sound strange to some of you at first. Why does someone in a coma need vitamins ASAP? Many people suffering from alcohol use disorder are also prone to malnutrition, be it for several reasons, like neglecting solid food intake due to the massive amounts of liquid they ingest, or lacking the resources for proper food intake to get money to go buy the alcohol. And among the many nutritional deficiencies, vitamin B1 can provoke an illness known as Wernicke-Korsakoff syndrome, which I'll discuss at a later point in some other video, but which can also lead to impairments of consciousness along with other symptoms. The main treatment for this acute condition is an immediate high-dose vitamin B1 treatment. And so, after beginning the treatment, the Brazilian patient was transferred to the ICU. The treatment, contrary to the doctor's working theory of Wernicke encephalopathy, only improved the man's consciousness slightly, which should usually not be the case with Wernicke-Korsakoff disease. The man was still on breathing support and continued to develop multiple pulmonary infections, as being mechanically ventilated constitutes a facilitated entryway to bacteria. He could not be taken off breathing support and had to receive a tracheotomy to be ventilated properly, something all intubated patients eventually receive after being intubated for several days. But even after 10 entire weeks, he was still in a coma and eventually became feverish and septic, tanking his vitals. In the next 24 hours, his vitals continued to drop into dangerous lows, and so vasoactive agents such as noradrenaline were needed to keep a sufficient blood pressure to ensure blood flow to vital organs. Not knowing what they were specially dealing with, the ICU team began broad-spectrum IV antibiotics, without success, however. Now, what the team could not have known was that not antibiotics, but antimycotics were necessary to potentially stabilize the patient. His immune system was that badly suppressed after such a long ICU stay and a prolonged alcohol consumption that not bacteria, but a rare fungus known as Rhodotorula mucilaginosa had spread throughout his body and was later identified in blood cultures and tracheal secretions. After finding this out, the medical team began a treatment with intravenous amphotericin B, a highly powerful yet risky antimycotic with many side effects. This, however, was not enough, and unfortunately, the man died due to multi-organ failure as a result of septic shock. So, what was the reason for this patient's death? Was it the rare fungus that attacked him in a state of immunosuppression? Was it the multiple pulmonary infections prior? Was it the initial amount of alcohol in his system, and was it so high that it had led to a never-ending coma? Did the vitamin B1 administered by the medical team have any toxic side effects? Now, as a healthcare provider, when looking at a case of a patient ultimately dying, a reasonable causal chain of events and afflictions must be determined in order to ascertain an underlying cause of death, and furthermore to rule if the death was natural or unnatural, and if the police must be called to investigate. In this case, undoubtedly, the man's chronic alcohol consumption certainly led him to having a weakened immune system and led him to more easily succumbing to the pulmonary infections later in the ICU. However, the missing link between these two elements is the coma itself, which would have been way too prolonged for a quote-unquote normal intoxication and not vitamin B responsive enough for it to be Wernicke-Korsakoff syndrome. So, in all cases with comatose patients, a CT scan was made in the emergency situation, added on top with an MRI scan of the head once the patient was stabilized. There, the medical team saw several abnormal lesions in the frontal lobe and the corpus callosum, the latter being the connecting piece where millions of fibers are interconnecting associated regions of the two hemispheres of the brain. What the doctors discovered was marchiafava-bignami disease, or MBD for short. And it was MBD that had ultimately led to this man's death. Marchiafava-Bignami disease was first discovered by Italian doctors Ettore Marchiafava and Amico Bignami at the beginning of the 20th century, when it was first associated with heavy consumption of Chianti, a red wine. It is a disease with a progressive demyelination of the aforementioned corpus callosum, meaning that the millions of fibers passing in it lose their outer layer, called myelin, which is responsible for isolation and the effective travel of electrical activity, such as in a fiberglass cable, thus severely impairing signal transmission in the brain. These lesions can also be observed in other parts of the brain, but are most commonly seen in the corpus callosum. MBD is typically associated with alcohol consumption and malnutrition, with 80% of patients showing a lack of vitamin B1. However, its actual pathomechanisms are unknown, and not all of the patients suffering from MBD are alcoholics. Now, let me explain the possible problems when dealing with MBD as a clinician and what makes it so fascinating and challenging at the same time. 1. It is extremely rare. One does not simply think about MBD when first seeing a comatose patient with alcoholism in his medical history. At the time of 2004, only 250 cases had been described in medical literature. 2. Symptoms and clinical progression is so variable and there is no classic symptom constellation which might allow you as a possible first contact or urgent care worker to recognize it. MBD can slowly progress over time with changes in behavior and cognition, cognitive decline akin to dementia, slurred speech, gait disturbances, and generalized limb palsy. There, however, are also acute cases with epileptic seizures, rapid coma, and death. Researchers Tian et al. Have tried to classify two types of MBD according to their clinical progression, MRI findings, and prognosis. But this classification is empirical and flimsy at best. Which leads us directly to point 3. The MBD diagnosis is very difficult, and as previously mentioned, the medical team administered vitamin B1 because they suspected Wernicke-Korsakoff disease, the most important differential diagnosis to MBD, but the vitamins did not improve the patient's condition. This is something that could tick one off that there is more to this coma patient than simply a malnutrition gone haywire. Plus, with Wernicke-Korsakoff disease, there are other symptoms, most notably disturbances in oculomotor functions, and that was not the case here. As done in this case, the most sensitive way to diagnose MBD is through an MRI of the head, which might not be always available immediately. There, symmetrical lesions can be seen in the corpus callosum, the surrounding white matter, and the brain cortex. And as a typical manifestation of MBD, a so-called sandwich sign can be seen in the middle of the corpus callosum, with two bright layers surrounding a darker middle layer, along with structural disintegration of the corpus in more chronic cases of MBD. Lastly, even if you manage to pinpoint the MBD diagnosis in your patient, and if you do, congrats, there is no established therapy. Good clinical practice indicates high dosage IV therapy of B1 vitamins, such as in this case, that have led to better outcomes. Cortisone is another possible solution, although there has been little evidence for it other than single case studies, which might indicate that its main source of harming the brain is not necessarily an inflammatory process. Of course, the immediate ceasing of alcohol consumption is imperative to stop disease progression, as alcohol seems to be associated with a worse outcome. Thus, unfortunately, the prognosis of marchiafava-bignami disease remains dark. While partial recoveries are heard of, a full recovery is highly unlikely. Of the aforementioned 250 patients described until 2004, 200 had died. Another 30 suffered from severe dementia, and only 20 patients had shown symptom remission. And in the end, the man in this case had to pay with his life for the choices he made over 30 years. Alcoholism not only destroyed the man's life, but also left a gaping hole in his family. And that was the second case. Thank you for watching. Now, the goal of this video, or this final part, is not to come over as preachy, since we all have our habits that might not be the best for us. It is not my job as a healthcare provider to lecture you. It is to inform you to make your own decision. And while addiction is addiction and loss of control is part of the addiction, I believe that the most important part of preventing alcohol-induced diseases and death is prevention. So whenever you see an alcoholic beverage presented to you, you have a choice, not only to drink it or not, but to decide on how many you want to drink and what you do after you drink it, if you go home or if you go behind a steering wheel. And while the choice of drinking it or not is simple, for some people it is not easy. But always remember this, we all make choices, but in the end our choices make us. And I believe that you make the right choice, and I trust in you that you do. Thank you for watching. I hope that you have enjoyed the video if you can enjoy such topics. And if you have any suggestions or corrections, let me know in the comments and I will gladly reply if time allows it. And I will see you next time, so take care.